Clinical features of essential thrombocytosis. So, essential thrombocytosis clinically, it is identified when a platelet count is obtained during the course of a routine medical evaluation. Supposing we have drawn blood for some reasons, so in that condition, platelet count will be raised. So, during a routine medical evaluation, platelet count will be raised. Occasionally, if you review previous blood counts, they might show that there was elevated platelet count, but it was overlooked for many years. So no symptoms or signs, these are specific for essential thrombocytosis. No specific symptoms or signs are specific for essential thrombocytosis, but these essential thrombocytosis patient, they can have this hemorrhagic and thrombotic tendencies. So these patients can have hemorrhagic and thrombotic tendencies. So this is expressed as easy bruising for the former and microvascular events for the later, such as erythromelalgia, ocular migraine, or TIA. So because of hemorrhagic tendency, there will be a easy bruising, and microvascular occlusive events such as there will be erythromelalgia, ocular migraine, or there will be a TIA. Physical examination is unremarkable. Splenomegaly, it is indicative of another myeloproliferative neoplasm. So in particular, polycythemia vera, primary myelofibrosis, or CML. If splenomegaly is there, it indicates another myeloproliferative neoplasm, and particularly the splenomegaly is seen with polycythemia vera, primary myelofibrosis, or chronic myeloid leukemia. Anemia, it is unusual, but mild neutrophil leukocytosis is not. The blood smear, it is most remarkable for the number of platelets present. So some of which may be very large. If we do a blood smear, the platelets are so many platelets will be there, number of platelets will be present, and some few platelets, they might be very large. And because of this large mass of circulating platelets, what will happen, it will prevent the accurate measurement of serum potassium, because to release of the platelet potassium upon blood clotting. If blood clots, what will happen? Platelet potassium will be released, and accurate measurement of serum potassium can't be done. So this type of hyperkalemia is a test tube artifact, and this is not associated with electrocardiographic abnormalities. So if we see hyperkalemia in presence of this increased platelet count, so this is a test tube artifact and not associated with electrocardiographic abnormalities. And similarly, arterial oxygen measurements are also inaccurate unless this, if we measure the arterial oxygen measurement, so these also can be inaccurate, unless collected on ice. Prothrombin and partial thromboplastin times are normal. Abnormalities of platelet function such as prolonged bleeding time and impaired platelet aggregation can be present. Prothrombin and partial thromboplastin, because those are clotting factor related, but abnormalities of platelet function such as prolonged bleeding time and impaired platelet aggregation can be present. No platelet function abnormality is characteristic of essential thrombocytosis, and no platelet function test will predict the risk of clinically significant bleeding or thrombosis. So the elevated platelet count, it will hinder marrow aspiration, but if you do a bone marrow biopsy, so this will reveal megakaryocyte hypertrophy and hyperplasia, and increase in marrow cellularity. So marrow will be more cellular, there will be megakaryocyte hypertrophy will be there, hyperplasia will be there, and if marrow reticulin is increased, another diagnosis should be considered. And